Hey there guys, it's Zach here, your friend from PC Medical Support Services based here in Slough. I hope you're well. It's absolutely freezing cold today. Now, I was asked to do a video a little while ago on what we carry in our main event ambulance. So I'm going to do that video today because I have a little bit of time to kill. So let's show you. So this is the front cab, as you can see, nice and clean. Dash cam there. So we've got two lots of crew helmets, so we make sure that the crew have got their PPE. Also high-vis jackets that are clearly marked. Primary response bag, which has got everything that they will need, which they can just grab as they get out. And also there are head torches and other bits and bobs in the box down there. The main patient compartment at the rear, I've opened all the drawers just to make it a lot easier to show you what we've got. And I'm very passionate about making sure that my vehicles are equipped to as close to the NHS. Obviously we don't have the budgets that they do, but we need to make sure that we have the equipment to be able to provide the same level of care. A lot of the events that we do potentially have activities that can be very dangerous, things like equestrian events and motocross and things like that, and there's always the chance that things can potentially go very wrong. So it's important that you're equipped to deal with those types of unfortunate occurrences. So we got a towel holder there, Zoll M series, which allows us to do a 12 lead ECG, 3 lead ECG, SpO2. It's also got an AED facility, also allows you to pace as well. Down here we've got our equipment for IV access, fluids, cannulation equipment, everything stored in there. More bits and bobs to be able to administer injections and so forth. Down here we carry the all important ice packs. I mean, these tend to be used a lot less now. We've got them, especially in the summer months, they can be quite useful. Those are kept in there. Portable oxygen, it's also a resus kit, carries BVMs, NPAs, OPAs and things like that, so that's all kept in that bag there. We've got an LSU aspirator, which allows us to move blood, secretions, vomit from the airway as part of the airway ladder. Parapack ventilator allows for hands-free ventilation of patients that are intubated, allows you to do other things. Furno Falcon stretcher, nicely made up. Spinal board. These tend to be more so used now for extricating people out of vehicles, but we've got a space to put it there, so we've put it there. And everything up here is to do with the airway. We've got oxygen masks, adult pediatric BVMs, we've got equipment in there for nebulization. Two drugs bags. The red one carries the main ambulance drugs, the yellow one carries general over-the-counter medications for when we do film sets. People ask you for silly things like strepsils and throaties and stuff like that, so we keep that in that bag. We've also got advanced airway equipment in the green pouch, that's a full intubation kit. The yellow pouch has also got advanced airways, things like LMAs and iGels and stuff like that. There's Entonox spares, mouthpieces, and just sort of supplementary bits for the airway kit. Over here we've got a maternity pack. We've got two lots of kits for major hemorrhages and things. We carry a lot of military dressings, Celox, hemostatic gauze and stuff like that. Over here we've got a burns kit. We've also then got equipment for fracture immobilization. We've got some frac straps there, we've got an arm splint there. Below that we carry collars, head blocks, tape to secure the head blocks. We also have the straps for the scoop and also the board. And below here, I haven't opened this one, but We've got clean blankets and sheets, oxygen cylinder there, which is piped through the vehicle to the 2 regulators that we have, one over there and one over here. To the rear of the vehicle, we've then also got scoop structure, carry chair, spare CD cylinder, wipes, sharp spin. I'm not going to open this because every time I open it the bottles fall out, but we keep water and cups and things like that in there. On this side we've got more first aid equipment, but this is more geared to fine dressings and suturing and steri stripping and all that sort of stuff. And on this side, this is just for patient comfort. So we've got things like receivers, bedpans, urinals, male and female, clinical waste bins. I've got a body bag in there. Clinical wipes, Inco pads, sanitary products and things like that, because you'd be surprised how many people approach you at events needing sanitary products. So we carry them now. Routinely, 3 lots of gloves, portable Entonox, and this side we've got vac splints, traction splints, and that pretty much is it. And you know, it's a vehicle that we use for most of the, well, all the events that we do, and we feel it's well equipped and able to deal with the sort of work that we do. It's well maintained, well looked after. It's cleaned regularly. It gets a steam clean once a week, and we're very, very proud of it. It's very, very important to have a vehicle that is equipped to be able to carry out the job that we do, because patient care is very, very important to us, and that's why we do what we do. But anyway, this is Zach from PC Medical Support Services signing out. Until next time, take care of yourselves and each other. Bye now.